Question 1. The control framework reveals that a certified diabetes educator, CDE, is developing an exercise plan for a patient with type 2 diabetes who has been diagnosed with moderate peripheral neuropathy and mild non-proliferative retinopathy. Which of the following approaches best reflects the CDE's professional responsibility in this situation? Option A. Encouraging the patient to engage in high-intensity interval training, HIIT, to maximize calorie expenditure, as this is generally beneficial for weight management in diabetes. Option B. Prescribing a vigorous weightlifting program to build muscle mass, as this is crucial for improving insulin sensitivity, and advising the patient to ignore any minor discomfort in their feet during workouts. Option C. Suggesting that the patient avoid all forms of exercise until their retinopathy is stable, as any physical exertion could potentially worsen their vision. Option D. Recommending a broad range of moderate-intensity aerobic and resistance exercises, emphasizing proper footwear and regular foot checks, and advising the patient to monitor blood glucose levels before and after exercise. Correct answer is D. Recommending a broad range of moderate-intensity aerobic and resistance exercises, emphasizing proper footwear and regular foot checks, and advising the patient to monitor blood glucose levels before and after exercise. Explanation. The control framework reveals that a certified diabetes educator, CDE, must conduct a thorough risk assessment before recommending or modifying an exercise program for an individual with diabetes and existing complications. This scenario is professionally challenging because it requires balancing the known benefits of exercise for diabetes management against the potential risks associated with specific complications like neuropathy, retinopathy, and cardiovascular disease. A one-size-fits-all approach is inappropriate and potentially harmful. The correct approach represents best professional practice because it prioritizes patient safety and individualized care, aligning with the ethical and professional standards expected of a CDE. This involves a systematic evaluation of the individual's specific medical history, current health status, the nature and severity of their complications, and their personal goals and preferences. This comprehensive assessment allows for the selection of appropriate types, intensities, and durations of exercise, as well as the implementation of necessary precautions and monitoring strategies. This aligns with the principle of beneficence and non-maleficence in healthcare, ensuring that the benefits of exercise outweigh the risks. An incorrect approach that fails to conduct a thorough risk assessment before recommending exercise for an individual with diabetes and complications is professionally unacceptable. This could lead to exacerbation of existing conditions, new injuries, or adverse events, violating the CDE's duty of care. For instance, recommending high-impact activities to someone with severe peripheral neuropathy could lead to foot injuries, ulcers, or even amputations. Similarly, recommending strenuous aerobic exercise without considering potential cardiovascular complications could trigger cardiac events. Such actions would constitute a breach of professional standards and potentially violate regulatory guidelines that mandate safe and effective patient care. The professional decision-making process for similar situations should involve a structured approach. 1. Patient assessment. Gather comprehensive information about the individual's diabetes history, current glycemic control, medications, and all existing complications, including their severity and impact on daily function. 2. Complication-specific considerations. Understand the specific risks and contraindications associated with each complication, e.g., retinopathy and activities that increase intraocular pressure, neuropathy and foot care, cardiovascular disease and exercise intensity. 3. Goal setting. Collaboratively establish realistic and safe exercise goals with the patient. 4. Exercise prescription. Develop an individualized exercise plan that considers the patient's capabilities, limitations, and preferences, incorporating appropriate modifications and safety measures. 5. Education and monitoring. Educate the patient on warning signs, self-monitoring techniques, and the importance of regular follow-up. 6. Collaboration. Consult with other healthcare professionals, e.g., physician, ophthalmologist, podiatrist, as needed to ensure a coordinated and safe approach. Question 2. The evaluation methodology shows a certified diabetes educator, CDE, is discussing HbA1c testing frequency with a patient who expresses a strong personal preference to test only once a year, citing a desire to avoid frequent blood draws and a belief that their current self-management is sufficient. The CDE knows that current guidelines recommend HbA1c testing every 3 to 6 months for most individuals with diabetes, depending on glycemic control. What is the most appropriate course of action for the CDE? Option A. Immediately agree to the patient's request for annual testing to maintain patient satisfaction and avoid conflict. Option B. Acknowledge the patient's preference but proceed with scheduling the next HbA1c test in 1 year without further discussion of risks or alternatives. Option C. Insist that the patient adhere to the recommended 3 to 6 month testing schedule, as it is the standard of care, and inform them of the consequences of noncompliance. Option D. Explain the rationale behind the recommended testing frequency. Discuss the potential risks of less frequent monitoring, and collaboratively develop a plan with the patient that addresses their concerns while aiming for optimal glycemic control. The correct answer is D. Explain the rationale behind the recommended testing frequency, discuss the potential risks of less frequent monitoring, and collaboratively develop a plan with the patient that addresses their concerns while aiming for optimal glycemic control. Explanation. Scenario analysis. This scenario presents a common ethical dilemma in diabetes education, where a patient's personal beliefs and preferences conflict with established clinical guidelines for HbA1c monitoring. The challenge lies in balancing patient autonomy and the educator's professional responsibility to promote evidence-based care and optimal health outcomes. The educator must navigate this without alienating the patient or compromising their trust, while still ensuring the patient understands the implications of their choices. Correct approach analysis. The correct approach prioritizes open communication, patient education, and shared decision-making, aligning with the ethical principles of beneficence, non-maleficence, and respect for autonomy. It involves clearly explaining the rationale behind the recommended HbA1c testing frequency, referencing current guidelines, e.g., American Diabetes Association Standards of Care, which are the likely framework for CDE certification in the U.S., and discussing the potential risks of delayed monitoring. The educator then empowers the patient to make an informed decision, offering support and a plan for follow-up, which respects their right to self-determination while still advocating for their health. This approach upholds professional standards by ensuring the patient is fully informed and involved in their care plan. Incorrect approaches analysis. One incorrect approach involves dismissing the patient's concerns and insisting on the recommended testing frequency without further discussion. This fails to respect patient autonomy and can lead to a breakdown in the therapeutic relationship, potentially causing the patient to disengage from care. It also neglects the educator's duty to explore barriers to adherence and find collaborative solutions. Another incorrect approach is to immediately concede to the patient's request without adequately explaining the risks or exploring alternatives. This prioritizes immediate patient comfort over long-term health outcomes and could be seen as a failure to provide competent care, potentially violating the principle of beneficence. It also misses an opportunity to educate the patient on the importance of HbA1c in managing their diabetes. A third incorrect approach might involve agreeing to the patient's request, but failing to document the discussion or establish a clear plan for future monitoring. This creates a gap in care and leaves the patient vulnerable to potential complications without proper oversight. It also represents a failure in professional documentation and accountability. Professional reasoning. Professionals should approach such situations by first actively listening to and validating the patient's concerns. They should then clearly articulate the evidence-based recommendations, explaining the why behind them in understandable terms. The next step is to explore the patient's reasons for their preference and identify any barriers to adherence. Collaborative problem-solving should then be employed to find a mutually agreeable plan that minimizes risks. Documentation of the discussion, the patient's decision, and the agreed-upon plan is crucial for continuity of care and professional accountability. Question 3. Assessment of a pregnant patient at 24 weeks gestation reveals a family history of type 2 diabetes and a previous diagnosis of GDM in a prior pregnancy. The patient reports no current symptoms of hyperglycemia. Which of the following represents the most appropriate next step in managing this patient's risk for gestational diabetes, adhering to standard screening protocols? Option A. Advise the patient on general healthy eating principles and schedule a follow-up appointment in 4 weeks to reassess symptoms. Option B. Recommend a random blood glucose check at the patient's next routine prenatal visit, as symptoms are absent. Option C. Perform a fasting plasma glucose (FPG) test only, as this is a sufficient initial screening method for all pregnant individuals. Option D. Initiate a 75-gram, 2-hour oral glucose tolerance test (OGT) immediately, as per established guidelines for high-risk pregnancies. The correct answer is D. Initiate a 75-gram, 2-hour oral glucose tolerance test (OGT) immediately, as per established guidelines for high-risk pregnancies. Explanation: Scenario analysis. This scenario presents a common yet complex challenge in gestational diabetes mellitus (GDM) management. The professional must navigate the interplay of hormonal changes unique to pregnancy, the physiological development of insulin resistance, and the critical need for timely and accurate screening and diagnosis. The challenge lies in applying evidence-based guidelines to individual patient circumstances, considering potential confounding factors, and ensuring effective management strategies are implemented to protect both maternal and fetal health. Misinterpretation of screening results or delayed diagnosis can have significant adverse outcomes, making precise application of diagnostic criteria paramount. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's risk factors and adherence to established screening protocols, as defined by relevant professional bodies and regulatory guidelines for certified diabetes educators. This includes understanding the specific diagnostic criteria for GDM, which are typically based on glucose challenge tests and subsequent oral glucose tolerance tests, and interpreting these results within the context of the patient's gestational age. Best professional practice dictates a proactive and evidence-based approach to screening and diagnosis, ensuring that all pregnant individuals are assessed according to recommended timelines, and that confirmed GDM is managed promptly with appropriate lifestyle modifications, and if necessary, pharmacologic intervention. This aligns with ethical obligations to provide competent and safe care, minimizing risks associated with hyperglycemia during pregnancy. Incorrect approaches analysis. One incorrect approach would be to rely solely on subjective patient reports of symptoms without initiating standardized screening, as this bypasses established diagnostic pathways and could lead to misdiagnoses. This fails to adhere to regulatory requirements for systematic screening and diagnostic procedures, potentially violating standards of care. Another incorrect approach would be to delay diagnosis or management based on a single elevated glucose reading without completing the full diagnostic workup as per guidelines. This represents a failure to follow established protocols and could result in prolonged exposure to hyperglycemia, posing risks to both mother and fetus, and is ethically unsound due to the potential for harm. A further incorrect approach would be to apply diagnostic criteria for non-pregnant individuals or those with type 1 or type 2 diabetes to a pregnant patient with suspected GDM. This demonstrates a lack of understanding of the unique physiological changes in pregnancy and the specific diagnostic standards for GDM, leading to inaccurate assessment and potentially inappropriate management. Professional reasoning. Professionals should approach GDM management by first identifying the patient's gestational stage and assessing for risk factors. They must then adhere strictly to the recommended screening protocols, utilizing the appropriate diagnostic tests and interpreting results according to established criteria. This systematic process ensures accurate diagnosis and timely initiation of management strategies, which may include dietary counseling, exercise recommendations, and, if indicated, pharmacologic therapy. Continuous monitoring and patient education are crucial throughout the pregnancy to optimize outcomes. Question 4. Comparative studies suggest that while standardized macronutrient recommendations are valuable for diabetes management, patient adherence and long-term success are significantly influenced by cultural food practices. A certified diabetes educator, CDE, is working with a patient from a cultural background where traditional meals are central to family gatherings and celebrations, and these meals often feature high carbohydrate, starchy staples prepared in specific ways. The patient expresses a strong desire to maintain these cultural traditions while managing their diabetes. Which of the following approaches best reflects ethical and professional best practice for the CDE in this situation? Option A. Advise the patient to strictly adhere to a universally recommended low-carbohydrate diet, explaining that cultural traditions must be secondary to achieving optimal blood glucose control. Option B. Focus solely on teaching the patient to count carbohydrates from any food source, without delving into the cultural significance or preparation methods of their traditional meals. Option C. Collaboratively explore how the patient's traditional foods can be incorporated into their diabetes management plan by focusing on portion sizes, preparation methods, and timing of meals, while also educating on carbohydrate counting and quality in a culturally sensitive manner. Option D. Recommend that the patient gradually eliminate traditional high-carbohydrate foods from their diet over time, suggesting they explore alternative, lower-carbohydrate cultural dishes if available. Correct answer is C. Collaboratively explore how the patient's traditional foods can be incorporated into their diabetes management plan by focusing on portion sizes, preparation methods, and timing of meals, while also educating on carbohydrate counting and quality in a culturally sensitive manner. Explanation: this scenario presents a professional challenge due to the inherent conflict between a patient's deeply held cultural beliefs and evidence-based nutritional recommendations for diabetes management. The Certified Diabetes Educator, CDE, must navigate this delicate situation with cultural sensitivity, ethical integrity, and a commitment to patient-centered care, all while adhering to professional practice guidelines. The CDE's primary responsibility is to empower the patient to make informed decisions that promote their health and well-being, respecting their autonomy and cultural context. The correct approach represents best professional practice because it prioritizes a collaborative and educational strategy. By acknowledging the patient's cultural practices, the CDE can build trust and rapport. The focus on understanding the impact of traditional foods on blood glucose, rather than outright prohibition, allows for a more nuanced and sustainable approach to carbohydrate counting and quality. This aligns with ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, as well as professional guidelines that emphasize individualized care and cultural competence. The CDE's role is to educate and guide, not dictate, enabling the patient to integrate their cultural heritage with effective diabetes management strategies. An incorrect approach that dismisses the patient's cultural practices outright would be ethically and professionally unacceptable. This would violate the principle of respect for autonomy and could lead to patient disengagement, mistrust, and potentially poorer health outcomes if the patient feels alienated or misunderstood. It also fails to acknowledge the importance of cultural context in adherence to treatment plans, a key consideration in effective diabetes education. Another incorrect approach that focuses solely on macronutrient ratios without considering the patient's food preferences and cultural significance would be a missed opportunity for effective education. While macronutrient recommendations are important, their practical application is heavily influenced by what a patient actually eats and enjoys. Ignoring this aspect can lead to recommendations that are difficult to follow, ultimately undermining the patient's ability to manage their diabetes effectively. This approach lacks the individualized and culturally sensitive lens required for successful diabetes self-management support. A further incorrect approach that involves imposing a rigid dietary plan without exploring the patient's current eating habits and cultural context would also be professionally flawed. This top-down method disregards the patient's lived experience and can create resistance. Effective diabetes education requires understanding the patient's current reality and working collaboratively to find solutions that are both medically sound and culturally appropriate. The professional decision-making process for similar situations should involve active listening, empathetic inquiry, and a commitment to shared decision-making. The CDE should first seek to understand the patient's cultural background and dietary practices. Then, they should explain the physiological impact of different food choices on blood glucose levels in a clear and accessible manner. The next step is to collaboratively explore how traditional foods can be incorporated into a balanced meal plan, focusing on portion control, preparation methods, and the timing of meals. The CDE should also offer education on carbohydrate counting and quality, providing practical strategies that respect the patient's cultural context. Throughout this process, the CDE must remain non-judgmental and supportive, empowering the patient to make informed choices that align with both their cultural identity and their health goals. Question 5. The efficiency study reveals that a certified diabetes educator, CDE, is reviewing patient charts to refine their approach to setting glycemic targets. Which of the following strategies best reflects current best practices for individualizing glycemic goals for patients with diabetes? Option A. Prioritizing patient-stated preferences for glycemic targets above all other clinical considerations to promote autonomy. Option B. Developing individualized glycemic targets based on a comprehensive assessment of the patient's age, comorbidities, risk of hypoglycemia, and personal life circumstances. Option C. Establishing a universally stringent HbA1c target for all patients to ensure consistent, high-quality care across the board. Option D. Focusing solely on achieving a specific HbA1c level as the primary indicator of successful diabetes management, irrespective of other patient factors. The correct answer is C. Establishing a universally stringent HbA1c target for all patients to ensure consistent, high-quality care across the board. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified diabetes educator, CDE, to balance general guidelines with the unique physiological and psychosocial needs of an individual. Overly rigid adherence to a single glycemic target without considering the patient's specific circumstances can lead to suboptimal outcomes, increased risk of hypoglycemia or hyperglycemia, and a breakdown in the patient-provider relationship. The CDE must navigate the complexities of age-related physiological changes, the impact of comorbidities on treatment efficacy and safety, and the patient's personal risk factors for complications or adverse events. Correct approach analysis. The correct approach emphasizes individualized glycemic targets. This aligns with best practices in diabetes management, which are increasingly patient-centered. Regulatory frameworks and professional guidelines for CDEs, assuming U.S. jurisdiction for this example, as no specific jurisdiction was provided, but adhering to general best practices that would be reflected in U.S. standards like those from the American Diabetes Association, advocate for tailoring goals based on a comprehensive assessment of the individual. This includes considering the patient's age, life expectancy, presence of comorbidities, e.g., cardiovascular disease, renal impairment, risk of hypoglycemia, patient motivation, and access to support. Establishing realistic and achievable targets fosters adherence, reduces the burden of diabetes management, and minimizes the risk of long-term complications and acute events, thereby promoting overall well-being and quality of life. This approach is ethically sound as it prioritizes patient autonomy and beneficence. Incorrect approach is analysis. One incorrect approach involves setting a universally stringent glycemic target for all patients, regardless of individual factors. This fails to acknowledge the heterogeneity of the diabetes population and can lead to overtreatment, increasing the risk of hypoglycemia, particularly in older adults or those with significant comorbidities. Such an approach may violate the ethical principle of non-maleficence by exposing the patient to unnecessary harm. It also disregards the principle of beneficence by not optimizing care for the individual's specific needs and risks. Another incorrect approach is to solely rely on the patient's stated preferences without a thorough clinical assessment of their capacity and the feasibility of achieving those preferences. While patient preference is crucial, a CDE has a professional responsibility to guide patients towards safe and effective goals. Ignoring clinical realities can lead to unrealistic expectations and potential harm. This could be seen as a failure in professional judgment and potentially a breach of duty of care. A third incorrect approach might be to focus exclusively on HbA1c as the sole metric for success, neglecting other important indicators of glycemic control and overall health, such as time in range, frequency of hypoglycemia, and patient-reported outcomes. This narrow focus can lead to a misinterpretation of a patient's status and may not reflect the true impact of diabetes management on their daily life and long-term health. Professional reasoning. Professionals should employ a shared decision-making model. This involves a thorough assessment of the patient's clinical status, including age, comorbidities, risk factors for hypoglycemia, and potential for complications. Simultaneously, the CDE must engage in open communication with the patient to understand their lifestyle, values, goals, and perceived barriers to care. Based on this comprehensive understanding, the CDE, in collaboration with the patient and their healthcare team, can then establish individualized glycemic targets that are safe, effective, and achievable, promoting optimal health outcomes and quality of life. Question 6. To address the challenge of accurately diagnosing diabetes in a patient presenting with mild, nonspecific symptoms and a history of gestational diabetes in a previous pregnancy, which of the following diagnostic strategies best aligns with current best practices for certified diabetes educators? Option A. Forming a fasting plasma glucose (FPG) test without ensuring the patient has fasted for at least 8 hours prior to the blood draw. Option B. Administering an oral glucose tolerance test (OGT) and interpreting the results according to established diagnostic thresholds. Option C. Ordering an HbA1c test and immediately diagnosing diabetes if the result falls within the pre-diabetic range, without considering confirmatory testing. Option D. Relying solely on a single random plasma glucose measurement taken at the time of the patient's visit, regardless of the reading. The correct answer is B. Administering an oral glucose tolerance test (OGT) and interpreting the results according to established diagnostic thresholds. Explanation: Scenario analysis. This scenario is professionally challenging because accurately diagnosing diabetes requires strict adherence to established diagnostic criteria. Misinterpreting or misapplying these criteria can lead to delayed diagnosis, inappropriate treatment, or unnecessary anxiety for the patient. The Certified Diabetes Educator (CDE) must navigate patient history, potential confounding factors, and the specific requirements of the diagnostic tests to ensure a correct and timely diagnosis, aligning with professional standards and patient safety. Correct approach analysis. The correct approach involves utilizing the most appropriate diagnostic test based on the patient's presentation and clinical context, and then interpreting the results strictly according to the established diagnostic criteria. For instance, if a patient presents with classic symptoms of hyperglycemia, a random plasma glucose test might be a suitable initial step, but confirmation with FPG or HbA1c would be necessary if the random glucose is borderline or if symptoms are not pronounced. If a patient is asymptomatic but has risk factors, an FPG or OGT would be the preferred initial diagnostic tests. The interpretation must then align with the specific numerical thresholds defined by the relevant professional bodies, e.g., American Diabetes Association standards, which are typically followed in CDE practice in the U.S. This ensures that the diagnosis is made based on objective, evidence-based criteria, promoting patient safety and appropriate management. Incorrect approaches analysis. One incorrect approach would be to rely solely on a single random plasma glucose reading without considering the patient's symptoms or the need for confirmatory testing if the result is not clearly diagnostic. This fails to adhere to the established diagnostic pathways, which often require confirmation, especially if the result is not unequivocally high. This can lead to either a false positive or a false negative diagnosis. Another incorrect approach would be to interpret an HbA1c result without considering potential interfering factors. For example, certain conditions affecting red blood cell turnover, like anemia or hemoglobinopathies, can affect HbA1c readings, potentially leading to a misdiagnosis. A responsible CDE would be aware of these limitations and consider alternative or confirmatory testing in such cases, adhering to the principle of accurate and reliable diagnosis. A third incorrect approach would be to use a fasting plasma glucose (FPG) result that was not obtained after an adequate fasting period, typically at least 8 hours. An inadequate fast can lead to falsely elevated FPG readings, potentially resulting in an incorrect diagnosis of diabetes. This demonstrates a failure to follow the procedural requirements for the diagnostic test, undermining its validity. Professional reasoning. Professionals should approach diagnostic challenges by first identifying the patient's clinical presentation and risk factors. Then, they should determine the most appropriate diagnostic test, based on established guidelines. Crucially, they must ensure that the tests are performed correctly and that the results are interpreted strictly according to the defined diagnostic criteria. If there are any ambiguities or potential interfering factors, further testing or consultation with a physician is warranted to ensure diagnostic accuracy and patient well-being. This systematic, evidence-based approach minimizes diagnostic errors and upholds the highest standards of patient care. Question 7. Quality control measures reveal a patient is focusing solely on the sugar content listed on a packaged food item's nutrition facts panel, expressing concern about its impact on their diabetes. The Certified Diabetes Educator, CDE, needs to address this observation effectively. Which of the following approaches best aligns with regulatory requirements and best professional practice for patient education? Option A. Advise the patient that if sugar is listed, the food is generally not suitable for individuals managing diabetes, regardless of other nutritional information. Option B. Guide the patient to examine the serving size listed on the panel and discuss how the total sugar content relates to that specific portion, while also reviewing other relevant nutrients like fiber and protein for a balanced perspective. Option C. Provide a general recommendation about limiting processed foods without directly referencing the specific food label the patient is questioning. Option D. Tell the patient to ignore the sugar content and focus only on the calorie count for their diabetes management. The correct answer is B. Guide the patient to examine the serving size listed on the panel and discuss how the total sugar content relates to that specific portion, while also reviewing other relevant nutrients like fiber and protein for a balanced perspective. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the Certified Diabetes Educator, CDE, to navigate a patient's potential misinterpretation of food labels, which can directly impact their diabetes management. The patient's reliance on a single nutrient without considering the overall nutritional context or serving size can lead to suboptimal dietary choices, potentially affecting glycemic control. The CDE must address the patient's specific concern while reinforcing comprehensive label reading skills within the established regulatory framework. Correct approach analysis. The correct approach involves guiding the patient to understand the entire nutrition facts panel, emphasizing the importance of serving size and the interplay of different nutrients. This aligns with the U.S. regulatory framework for food labeling, which mandates that nutrition facts panels provide a comprehensive overview of a food's nutritional content per serving. By focusing on the serving size and the overall nutrient profile, the CDE promotes accurate interpretation and empowers the patient to make informed decisions that support their diabetes management goals, adhering to ethical guidelines of patient education and promoting self-management. Incorrect approaches analysis. One incorrect approach involves solely focusing on the patient's stated concern about a single nutrient without contextualizing it within the serving size or the rest of the panel. This fails to address the potential for misinterpretation of the overall nutritional value of the food and neglects the regulatory intent of the nutrition facts panel, which is to provide a holistic view. Ethically, this approach is insufficient as it does not fully equip the patient with the knowledge to make sound dietary choices. Another incorrect approach is to dismiss the patient's observation and simply state that the food is healthy or unhealthy without a detailed explanation. This is professionally unacceptable as it lacks evidence-based reasoning and bypasses the opportunity for patient education. It also fails to acknowledge the nuances of food labeling and the individual's role in interpreting it, potentially eroding patient trust and autonomy. A further incorrect approach is to provide a generic recommendation without referencing the specific food label. This fails to address the patient's immediate query and does not leverage the educational opportunity presented by the nutrition facts panel. It also overlooks the regulatory requirement for clear and understandable food labeling information, which the CDE should be able to interpret and explain. Professional reasoning. Professionals should approach such situations by actively listening to the patient's concerns, validating their observations, and then using the food label as a teaching tool. The decision-making process should involve 1. Identifying the patient's specific question or misconception. 2. Referring to the relevant regulatory guidance, in this case, U.S. FDA food labeling regulations. 3. Explaining the information on the label in a clear, concise, and patient-centered manner, focusing on the interplay of serving size, ingredients, and nutrient information. 4. Empowering the patient to apply this knowledge to other food choices. Question 8. The monitoring system demonstrates consistently elevated fasting blood glucose levels and intermittent postprandial spikes, alongside markers suggestive of increased oxidative stress and inflammatory markers in a patient with type 2 diabetes. Considering the established etiologies of diabetes complications, which of the following represents the most critical initial intervention strategy for the certified diabetes educator to prioritize in patient education and management? Option A. Recommending the immediate initiation of high-dose antioxidant supplements to combat elevated oxidative stress markers. Option B. Focusing on educating the patient about the role of advanced glycation end products age, and suggesting dietary modifications to limit AGE precursors. Option C. Emphasizing strategies to improve glycemic control through diet, exercise, and medication adherence to reduce the primary driver of hyperglycemia. Option D. Implementing a comprehensive anti-inflammatory diet plan to directly address the elevated inflammatory markers. The correct answer is C. Emphasizing strategies to improve glycemic control through diet, exercise, and medication adherence to reduce the primary driver of hyperglycemia. Explanation: scenario analysis. This scenario is professionally challenging because it requires the certified diabetes educator, CDE, to interpret complex physiological data from a monitoring system and translate it into actionable patient care strategies. The challenge lies in understanding the intricate interplay between hyperglycemia, oxidative stress, inflammation, and AGEs, and how these mechanisms contribute to the development of diabetes complications across various organ systems. The CDE must not only identify potential risks, but also prioritize interventions based on the most direct and impactful pathways, adhering strictly to evidence-based practices and patient-centered care principles. Correct approach analysis. The correct approach involves recognizing that sustained hyperglycemia is the primary driver that initiates a cascade of detrimental cellular events. This includes increased glucose metabolism through the polyol pathway and hexosamine biosynthesis pathway, leading to increased production of reactive oxygen species, ROS, thus fueling oxidative stress. Oxidative stress, in turn, triggers inflammatory pathways, further exacerbating cellular damage. Both oxidative stress and chronic hyperglycemia directly contribute to the formation of advanced glycation end products age, which bind to cellular receptors RAGE and amplify inflammation and oxidative stress. This vicious cycle directly impacts the microvasculature and macrovasculature, leading to complications in the eyes, retinopathy, kidneys, nephropathy, nerves, neuropathy, and cardiovascular system. Therefore, addressing the root cause hyperglycemia is the most effective initial strategy to mitigate the downstream effects of oxidative stress, inflammation, and AGE formation, thereby preventing or slowing the progression of complications. This aligns with the CDE's role in patient education and management, emphasizing lifestyle modifications and adherence to therapeutic regimens that control blood glucose levels. Incorrect approach is analysis. One incorrect approach would be to solely focus on managing individual symptoms of complications without addressing the underlying etiologies. For instance, if the monitoring system indicates early signs of nephropathy, focusing only on managing blood pressure without also addressing the hyperglycemia that contributes to the damage would be a failure to address the root cause. This neglects the interconnectedness of the pathological processes and represents a fragmented approach to care, potentially leading to suboptimal outcomes and continued progression of damage. Ethically, this could be viewed as a failure to provide comprehensive care. Another incorrect approach would be to prioritize interventions targeting oxidative stress or inflammation in isolation, without a foundational focus on glycemic control. While antioxidants and anti-inflammatory agents may have a role in adjunctive therapy, they are unlikely to be as effective in preventing or reversing the damage caused by persistent hyperglycemia. This approach fails to recognize hyperglycemia as the primary initiator of the pathological cascade and could lead to misallocation of resources and patient effort. Regulatory frameworks for diabetes education emphasize evidence-based interventions, and prioritizing unproven or adjunctive therapies over foundational glycemic control would be a deviation from best practice. A further incorrect approach would be to solely focus on AGE reduction strategies, without addressing the upstream causes of AGE formation. While AGEs are significant contributors to complications, their formation is a direct consequence of chronic hyperglycemia. Interventions aimed at reducing AGEs without controlling blood glucose would be akin to treating a symptom without addressing the disease. This represents a misunderstanding of the disease pathophysiology and a failure to implement the most impactful interventions. Professional reasoning. When faced with data from a monitoring system indicating potential risks for diabetes complications, a CDE should employ a systematic, evidence-based approach. This involves 1. Identifying the primary driver. Recognize that hyperglycemia is the central pathological factor initiating the cascade. 2. Understanding the cascade. Comprehend how hyperglycemia leads to oxidative stress, inflammation, and AGE formation. 3. Prioritizing interventions. Focus on strategies that directly address the primary driver, glycemic control, as the most effective means of mitigating downstream effects. 4. Individualizing care. Tailor educational and management plans to the specific patient's needs, considering their current glycemic control, risk factors, and existing complications. 5. Continuous monitoring and evaluation. Regularly assess the effectiveness of interventions and adjust the plan as needed, always keeping the interconnectedness of the pathological processes in mind. This systematic approach ensures that patient care is grounded in a deep understanding of diabetes pathophysiology and adheres to the highest ethical and professional standards. Question 9. Operational review demonstrates that a patient with type 2 diabetes, a history of hypertension, and recent complaints of knee joint pain expresses a strong desire to begin a high-intensity interval training (HIIT) program they saw advertised. The Certified Diabetes Educator (CDE) needs to determine the most appropriate course of action. Option A. Advise the patient to avoid HIIT due to their hypertension and joint pain, and instead prescribe a low-impact, moderate-intensity exercise routine that the CDE deems suitable. Option B. Immediately approve the patient's request for a HIIT program, assuming that exercise is generally beneficial for diabetes management and that the patient's desire indicates readiness. Option C. Recommend the patient consult with their physician to discuss the feasibility and safety of a HIIT program given their medical history, and then collaboratively develop a modified or alternative exercise plan based on medical clearance and the patient's limitations. Option D. Provide the patient with general guidelines for safe exercise for individuals with diabetes without specifically addressing the HIIT request or consulting with their physician. The correct answer is C. Recommend the patient consult with their physician to discuss the feasibility and safety of a HIIT program given their medical history, and then collaboratively develop a modified or alternative exercise plan based on medical clearance and the patient's limitations. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the Certified Diabetes Educator (CDE) to balance a patient's expressed desire for a specific exercise regimen with the CDE's professional responsibility to ensure safety and efficacy, especially considering the patient's pre-existing health conditions. The CDE must navigate potential conflicts between patient autonomy and the duty of care, ensuring that recommendations are evidence-based and tailored to the individual's needs and limitations. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment before implementing any new exercise program. This aligns with the ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. It also adheres to professional guidelines for diabetes education, which emphasize personalized care plans. By consulting with the patient's physician, the CDE ensures that the proposed exercise plan is medically sound and does not contraindicate any existing health issues, thereby upholding the standard of care and professional responsibility. This collaborative approach also respects patient involvement while ensuring safety. Incorrect approaches analysis. One incorrect approach involves immediately approving the patient's requested high-intensity interval training (HIIT) program without further assessment. This fails to uphold the duty of care by potentially exposing the patient to undue risk of injury or adverse health events, especially given their history of hypertension and joint pain. It bypasses essential safety protocols and the principle of non-maleficence. Another incorrect approach is to dismiss the patient's request outright and mandate a different, less preferred exercise. This disregards patient autonomy and can lead to decreased engagement and adherence to the diabetes management plan. While safety is paramount, a collaborative and motivational approach is crucial for long-term success, and simply dictating an exercise plan can be demotivating and counterproductive. A third incorrect approach is to provide generic exercise advice without considering the patient's specific conditions or the requested activity. This lacks the personalized approach required for effective diabetes education and fails to address the potential risks associated with the patient's hypertension and joint pain in the context of HIIT. It is a failure to provide tailored, evidence-based guidance. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough assessment of the patient's current health status, including any comorbidities and physical limitations. This should be followed by a discussion of the patient's goals and preferences, fostering shared decision-making. Next, the professional must evaluate the safety and appropriateness of the patient's desired interventions in light of their health status and evidence-based guidelines. If the desired intervention is potentially risky or requires modification, consultation with other healthcare providers, like the patient's physician, is essential. Finally, the professional should collaboratively develop a safe, effective, and personalized plan that the patient is motivated to follow, with clear strategies for monitoring progress and addressing any challenges. Question 10. Strategic planning requires a certified diabetes educator to thoroughly evaluate a patient's comprehensive laboratory results to inform an individualized care plan. Given a patient's recent lab report showing an elevated HbA1c, a low C-peptide level, a concerning lipid profile with high LDL cholesterol, and a declining estimated glomerular filtration rate, eGFR, which of the following represents the most appropriate next step for the CDE in their strategic planning process? Option A. Interpret the low C-peptide level as an indication that the patient no longer produces any insulin and recommend immediate initiation of a high-dose insulin regimen without further consultation. Option B. Advise the patient to immediately discontinue their current diabetes medication and switch to over-the-counter supplements recommended by a friend, as these results suggest the current treatment is ineffective. Option C. Discuss the implications of these combined results with the patient, emphasizing the need for potential adjustments to their diabetes medication, statin therapy, and blood pressure management, and collaborate with the patient's physician to review and refine the overall treatment strategy. Option D. Focus solely on reinforcing adherence to the current diabetes medication regimen, as the elevated HbA1c is the primary indicator of diabetes control. The correct answer is C. Discuss the implications of these combined results with the patient, emphasizing the need for potential adjustments to their diabetes medication, statin therapy, and blood pressure management, and collaborate with the patient's physician to review and refine the overall treatment strategy. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a certified diabetes educator, CDE, to interpret a complex set of laboratory results beyond the standard glucose and HbA1c, integrating information about endogenous insulin production, lipid health, and kidney function to inform a comprehensive diabetes management plan. The challenge lies in synthesizing these diverse biomarkers to identify potential complications, assess treatment efficacy, and tailor individualized care strategies, all while adhering to professional standards and ethical obligations. Correct approach analysis. The correct approach involves a holistic review of all provided biomarkers in conjunction with the patient's clinical presentation and history. This aligns with best professional practice as outlined by the professional standards for CDEs, which emphasize comprehensive patient assessment and individualized care planning. Specifically, evaluating C-peptide levels helps determine residual endogenous insulin production, guiding decisions about insulin therapy. Lipid profiles are crucial for assessing cardiovascular risk, a significant comorbidity in diabetes. Kidney function tests, e.g., eGFR, urine albumin to creatinine ratio, are essential for early detection and management of diabetic nephropathy. Integrating these findings allows for a proactive and evidence-based approach to diabetes management, minimizing the risk of long-term complications and optimizing patient outcomes. This approach is ethically sound as it prioritizes patient well-being and promotes informed decision-making. Incorrect approaches analysis. One incorrect approach would be to focus solely on the HbA1c and glucose levels, disregarding the other biomarkers. This fails to meet the professional standard of comprehensive assessment and could lead to missed opportunities for early intervention in complications like nephropathy or cardiovascular disease. Ethically, it represents a failure to provide complete and thorough care. Another incorrect approach would be to interpret each biomarker in isolation, without considering their interrelationships and the patient's overall health status. For instance, high LDL cholesterol might be managed aggressively without considering the impact of kidney function on medication choices or dosages. This fragmented approach is not evidence-based and can lead to suboptimal or even harmful treatment decisions, violating the ethical principle of beneficence. A third incorrect approach would be to make definitive diagnoses or treatment recommendations based solely on abnormal biomarker results without consulting the patient's physician or other members of the healthcare team. While CDEs play a vital role in patient education and management, they operate within a collaborative framework. Overstepping professional boundaries or providing medical advice beyond their scope of practice is a regulatory and ethical failure. Professional reasoning. Professionals should adopt a systematic approach. 1. Review all available laboratory data, including C-peptide, insulin levels, lipid profiles, and kidney function tests, alongside the patient's medical history, current medications, and lifestyle factors. 2. Analyze each biomarker in the context of established reference ranges and the patient's individual health profile. 3. Synthesize the findings to identify potential risks, complications, and areas for intervention. 4. Collaborate with the patient and their healthcare team to develop or refine an individualized diabetes management plan that addresses all identified issues. 5. Educate the patient about the significance of these biomarkers and how they relate to their overall health and management goals. Question 11. The investigation demonstrates a patient, newly diagnosed with type 2 diabetes, expresses a strong preference for using various artificial sweeteners in their beverages and foods, stating they believe these are a healthier alternative to sugar. As a certified diabetes educator, CDE, what is the most appropriate initial step to address this patient's preference and integrate it into their diabetes management plan? Option A. Engage in a detailed discussion with the patient to understand their current usage patterns, perceived benefits, and any specific concerns they have about artificial sweeteners, before providing evidence-based information on their impact on blood glucose and overall health. Option B. Provide the patient with a generic handout on the glycemic index of various sweeteners, including both natural and artificial options, and instruct them to review it to make their own informed choices. Option C. Immediately advise the patient to discontinue all artificial sweetener use, explaining that, while they may not directly raise blood glucose, they can contribute to cravings and are not a sustainable long-term solution for diabetes management. Option D. Focus the conversation on the potential negative health effects of artificial sweeteners, such as gut microbiome disruption, and recommend they transition to naturally sweet fruits for their sweetness needs. The correct answer is A. Engage in a detailed discussion with the patient to understand their current usage patterns, perceived benefits, and any specific concerns they have about artificial sweeteners, before providing evidence-based information on their impact on blood glucose and overall health. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a certified diabetes educator, CDE, to navigate a patient's personal preferences and beliefs regarding food choices, specifically the use of artificial sweeteners, while ensuring the advice aligns with evidence-based diabetes management and regulatory guidelines. The CDE must balance patient autonomy with the professional responsibility to provide safe and effective recommendations that support glycemic control and overall health. The challenge lies in discerning when a patient's preference might inadvertently compromise their health goals or contradict established best practices. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment and collaborative decision-making process. This aligns with the ethical principles of patient-centered care and informed consent, which are foundational to healthcare practice. By first understanding the patient's current usage, motivations, and any perceived effects, the CDE can then provide tailored, evidence-based education. This approach respects the patient's autonomy while ensuring that any recommendations are grounded in scientific understanding of how sweeteners impact blood glucose and are consistent with regulatory guidance on diabetes education and nutrition. The CDE's role is to empower the patient with knowledge to make informed choices, not to dictate them. Incorrect approaches analysis. One incorrect approach fails by immediately dismissing the patient's preference without understanding its context or potential impact. This is a failure of patient-centered care and can lead to a breakdown in the therapeutic relationship. It also bypasses the opportunity to educate the patient on the nuances of sweetener use, potentially leaving them misinformed or continuing a practice that may not be optimal. Ethically, this approach disregards patient autonomy and the principle of shared decision-making. Another incorrect approach is to provide generalized advice without assessing the patient's specific situation. This lacks the individualized approach required for effective diabetes management. While the information might be factually correct, its application without considering the patient's unique needs, other dietary habits, and potential sensitivities is not best practice. This can lead to ineffective management and potentially missed opportunities for personalized guidance. Regulatory frameworks for diabetes education emphasize individualized care plans. A third incorrect approach involves focusing solely on the natural aspect of sweeteners without considering their glycemic impact or the patient's overall dietary pattern. This can be misleading, as some natural sweeteners can significantly affect blood glucose levels. It also fails to address the core concern of glycemic control, which is paramount in diabetes management. This approach may inadvertently promote choices that are detrimental to the patient's health goals, violating the CDE's duty of care. Professional reasoning. Professionals should employ a decision-making framework that begins with active listening and a thorough assessment of the patient's current situation, including their understanding, beliefs, and practices. This is followed by providing evidence-based information tailored to the patient's needs and goals. The process should be collaborative, involving shared decision-making where the patient actively participates in setting goals and choosing strategies. Finally, ongoing monitoring and adjustment of the plan are crucial to ensure effectiveness and patient well-being, always adhering to relevant professional standards and regulatory guidelines. Question 12. Upon reviewing a patient's dietary recall, a certified diabetes educator, CDE, notes that the patient's current fiber intake is significantly below the recommended daily amount for individuals with diabetes. The patient expresses a desire to improve their diet, but is unsure where to start and has concerns about potential digestive discomfort if they increase fiber too quickly. Which of the following approaches best reflects best professional practice for the CDE in this situation? Option A. Recommend a high-fiber supplement immediately to ensure rapid achievement of the target fiber intake, advising the patient to start with a full dose. Option B. Provide the patient with a comprehensive pamphlet listing all foods considered high in fiber and instruct them to choose items from this list to reach the recommended daily intake. Option C. Emphasize that increasing fiber is crucial for diabetes management and insist the patient adopt a very high-fiber diet immediately, regardless of their expressed concerns about digestive issues. Option D. Assess the patient's current fiber intake, identify potential barriers and facilitators to increasing fiber, and collaboratively develop a personalized plan that gradually introduces various types of fiber-rich foods, explaining their benefits and providing practical strategies for incorporation. The correct answer is D. Assess the patient's current fiber intake, identify potential barriers and facilitators to increasing fiber, and collaboratively develop a personalized plan that gradually introduces various types of fiber-rich foods, explaining their benefits and providing practical strategies for incorporation. Explanation. This scenario is professionally challenging because it requires a certified diabetes educator, CDE, to translate complex dietary recommendations into actionable, individualized advice for a patient with diabetes, considering their specific needs and preferences while adhering to established guidelines. The CDE must assess the patient's current understanding and dietary habits to provide effective education that promotes improved glycemic control and overall health. The correct approach represents best professional practice because it prioritizes a patient-centered, evidence-based strategy. It involves assessing the patient's current fiber intake, understanding their barriers and facilitators to increasing fiber, and then providing tailored recommendations based on established guidelines for individuals with diabetes. This aligns with ethical principles of beneficence and autonomy, ensuring the patient receives appropriate care and is empowered to make informed decisions. Regulatory frameworks for CDEs emphasize the importance of individualized care plans and patient education grounded in scientific evidence. An incorrect approach that focuses solely on providing a generic list of high-fiber foods without assessing the patient's current intake or understanding fails to meet the standard of individualized care. This could lead to overwhelming the patient or recommending foods that are not suitable for their cultural background, budget, or existing health conditions, potentially leading to non-adherence and suboptimal outcomes. Ethically, this approach neglects the principle of tailoring interventions to individual needs. Another incorrect approach that involves recommending a specific, high-fiber supplement without a thorough dietary assessment and consideration of potential gastrointestinal side effects or interactions with medications is also professionally unacceptable. This bypasses the fundamental step of understanding the patient's dietary patterns and could lead to adverse effects, violating the principle of non-maleficence. Regulatory guidelines for CDEs stress the importance of a comprehensive assessment before recommending interventions. A further incorrect approach that dismisses the patient's concerns about increasing fiber intake due to perceived difficulty or taste preferences, and instead insists on a rigid, one-size-fits-all recommendation, demonstrates a lack of empathy and patient-centeredness. This approach fails to acknowledge the patient's lived experience and can erode trust, hindering the therapeutic relationship. Professional decision-making in such situations requires active listening, empathetic communication, and collaborative goal setting, ensuring that recommendations are practical and sustainable for the individual. The CDE must navigate the balance between evidence-based recommendations and the patient's unique circumstances, always prioritizing their well-being and ability to implement changes. Question 13. Operational review demonstrates that a certified diabetes educator, CDE, is working with a patient of South Asian descent who expresses a strong preference for traditional cultural dishes, many of which are high in refined carbohydrates and saturated fats. The patient is hesitant to adopt a diet that deviates significantly from their cultural norms. What is the most appropriate approach for the CDE to develop a medical nutrition therapy, MNT plan? Option A. Acknowledge the patient's cultural preferences but proceed with developing an MNT plan based on generic dietary recommendations, assuming the patient will eventually adapt to a more conventional approach. Option B. Present a standard, evidence-based MNT guideline for diabetes that emphasizes a low-carbohydrate, low-fat Western diet and strongly encourage the patient to adhere to it for optimal blood glucose control. Option C. Collaborate with the patient to identify modifications within their preferred cultural cuisine that align with MNT principles, focusing on portion control, healthier cooking methods, and incorporating more fiber-rich ingredients. Option D. Advise the patient that their current dietary habits are incompatible with effective diabetes management and suggest they seek guidance from a nutritionist specializing in their specific cultural cuisine. The correct answer is C. Collaborate with the patient to identify modifications within their preferred cultural cuisine that align with MNT principles, focusing on portion control, healthier cooking methods, and incorporating more fiber-rich ingredients. Explanation. Scenario analysis. This scenario presents a common challenge in diabetes management where a patient's cultural food preferences may conflict with standard MNT recommendations. The Certified Diabetes Educator, CDE, must navigate this by respecting patient autonomy and cultural identity, while ensuring the MNT plan is safe and effective for diabetes management. The challenge lies in finding a balance that promotes adherence and health outcomes without imposing a one-size-fits-all approach. Correct approach analysis. The most effective approach involves collaborative goal setting and culturally sensitive MNT. This aligns with best professional practice by empowering the patient, fostering trust, and increasing the likelihood of long-term adherence. It respects the patient's right to self-determination and acknowledges that effective diabetes education must be individualized. This approach is ethically sound, promoting beneficence and non-maleficence by tailoring care to the individual's needs and circumstances. Regulatory frameworks for CDEs emphasize patient-centered care and the importance of considering social determinants of health, including cultural factors, in developing MNT plans. Incorrect approaches analysis. One incorrect approach involves disregarding the patient's cultural food preferences and insisting on a generic, westernized diet plan. This fails to acknowledge the patient's autonomy and cultural background, potentially leading to resentment, non-adherence, and poorer health outcomes. Ethically, this approach can be seen as paternalistic and disrespectful. It also violates the principle of patient-centered care, which is a cornerstone of professional diabetes education. Another incorrect approach is to simply accept the patient's current dietary habits without attempting to integrate them into a healthier MNT plan. This neglects the CDE's professional responsibility to provide evidence-based guidance for diabetes management. While it avoids direct conflict, it fails to achieve the goals of MNT and could be considered a dereliction of professional duty, potentially leading to adverse health consequences for the patient. A third incorrect approach might be to provide a highly restrictive, overly complex MNT plan that is difficult for the patient to follow due to cultural or practical barriers. While well-intentioned, such a plan is unlikely to be sustainable and can lead to feelings of failure and discouragement for the patient. This approach overlooks the practical realities of the patient's life and cultural context, undermining the effectiveness of the MNT. Professional reasoning. Professionals should employ a shared decision-making framework. This involves active listening to understand the patient's concerns, values, and cultural practices. CDE should then educate the patient on the principles of MNT for diabetes, explaining how different food choices impact blood glucose levels. The next step is to collaboratively explore how the patient's preferred cultural foods can be incorporated into a balanced and healthy eating pattern, making modifications as needed to align with MNT goals. This iterative process ensures the MNT plan is both medically sound and culturally relevant, promoting patient engagement and successful self-management. Question 14. Examination of the data shows a patient with type 2 diabetes who is on oral medication and has been instructed on self-monitoring of blood glucose, SMBG, is reporting increasingly erratic and seemingly unexplainable blood glucose readings despite consistent adherence to their prescribed medication regimen. The patient expresses frustration and confusion regarding these results. As a certified diabetes educator, CDE, what is the most appropriate initial step to address this situation? Option A. Immediately recommend an increase in the patient's oral medication dosage to better manage the fluctuating glucose levels, assuming the current regimen is insufficient. Option B. Advise the patient that such fluctuations can be normal and encourage them to continue monitoring as prescribed without further investigation into their technique. Option C. Schedule a session with the patient to observe and review their SMBG technique, including proper lancet depth, strip handling, and blood sample application, to identify any potential procedural errors. Option D. Inform the patient that their inconsistent readings likely indicate a lack of effort or understanding on their part, and suggest they focus more on adhering to the instructions. The correct answer is C. Schedule a session with the patient to observe and review their SMBG technique, including proper lancet depth, strip handling, and blood sample application, to identify any potential procedural errors. Explanation. This scenario presents a common challenge in diabetes self-management education, ensuring accurate and effective self-monitoring of blood glucose, SMBG, practices. The professional challenge lies in translating theoretical knowledge of SMBG techniques into consistent, real-world application by the patient, and then interpreting the results to guide clinical decisions. This requires not only technical instruction, but also an understanding of patient adherence, potential errors, and the impact of various factors on glucose readings. Careful judgment is required to identify the root cause of inconsistent SMBG data and to provide tailored education and support. The correct approach represents best professional practice because it directly addresses the patient's reported difficulty and seeks to identify and rectify potential technique errors. This aligns with the ethical obligation to provide competent and individualized care, ensuring the patient can accurately monitor their glucose levels. Regulatory frameworks for diabetes education emphasize the importance of patient-centered care and the provision of accurate information and skills training. By systematically reviewing the SMBG technique, the educator is proactively identifying and mitigating potential sources of error, which is crucial for effective diabetes management and preventing adverse outcomes. This approach is also cost-effective and patient-empowering, as it aims to improve the patient's ability to manage their condition independently. An incorrect approach that focuses solely on adjusting medication without investigating the SMBG technique fails to address the potential underlying issue of inaccurate readings. This could lead to inappropriate medication adjustments, potentially causing hypoglycemia or hyperglycemia, and may mask a fundamental problem with the patient's monitoring skills. Ethically, This is a failure to provide thorough assessment and education. Regulatory guidelines often mandate that educators ensure patients have the necessary skills to manage their condition, and simply changing medication without verifying monitoring accuracy violates this principle. Another incorrect approach that dismisses the patient's concerns without further investigation is unprofessional and dismissive. It fails to acknowledge the patient's subjective experience and potential difficulties, which can erode trust and hinder the therapeutic relationship. This approach neglects the educator's responsibility to explore all possible explanations for the observed data and to provide comprehensive support. It is ethically unsound to ignore patient reports of difficulty, and regulatory bodies would expect a diligent and empathetic response. A further incorrect approach that suggests the patient is not trying hard enough is judgmental and counterproductive. It places blame on the patient rather than seeking to understand and address barriers to successful SMBG. This can lead to patient demoralization and disengagement from their diabetes management plan. Ethically, this is a violation of the principle of non-maleficence and a failure to provide supportive education. Regulatory expectations for diabetes educators include fostering a collaborative and encouraging environment, not one of criticism. The professional reasoning process should involve a systematic assessment of the patient's SMBG technique, including observing the patient perform the procedure, reviewing their understanding of the steps, and discussing common pitfalls. This should be followed by a collaborative discussion about the patient's lifestyle, diet, and medication adherence. Based on this comprehensive assessment, the educator can then provide targeted education, troubleshoot any identified issues, and collaboratively develop a revised SMBG plan. This iterative process ensures that the patient's monitoring is accurate and that the data generated is reliable for informing treatment decisions. Question 15. Performance analysis shows a patient with type 2 diabetes presenting with increasing HbA1c levels despite adherence to a prescribed oral medication regimen. The patient has a family history of diabetes, is classified as obese, and reports limited physical activity. The CDE is tasked with developing an updated management plan. Which of the following approaches best reflects a comprehensive understanding of the factors contributing to this patient's T2D progression? Option A. Recommend an immediate increase in the oral medication dosage and a referral to a weight loss program. Option B. Focus solely on reinforcing the importance of diet and exercise, assuming the current medication is sufficient if taken as prescribed. Option C. Advise the patient to monitor their blood glucose levels more frequently and adjust their medication based on these readings without further clinical evaluation. Option D. Conduct a thorough assessment of the patient's genetic predisposition, current lifestyle factors, obesity, physical inactivity, evidence of insulin resistance, and signs of beta cell dysfunction within the context of metabolic syndrome to inform a personalized educational and management strategy. The correct answer is A. Recommend an immediate increase in the oral medication dosage and a referral to a weight loss program. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the Certified Diabetes Educator, CDE, to navigate the complex interplay of multiple factors contributing to type 2 diabetes, T2D, progression in a patient. The CDE must move beyond simply identifying the presence of T2D to understanding the underlying pathophysiology and its dynamic nature. This involves assessing not only the patient's current lifestyle, but also their genetic predisposition and the potential for beta cell dysfunction, all within the context of metabolic syndrome. The challenge lies in synthesizing this information to develop a personalized, evidence-based, and ethically sound care plan that addresses the multifaceted nature of T2D progression, adhering strictly to the regulatory framework governing CDE practice. Correct approach analysis. The correct approach involves a comprehensive assessment that integrates the patient's genetic predisposition, current lifestyle factors, obesity, physical inactivity, evidence of insulin resistance, and signs of beta cell dysfunction, all within the framework of metabolic syndrome. This holistic view allows for a nuanced understanding of the disease's progression. By considering these interconnected elements, the CDE can identify the most impactful areas for intervention, tailor educational strategies, and collaborate with the healthcare team to optimize patient outcomes. This aligns with the ethical imperative to provide patient-centered care and the regulatory requirement to practice within the scope of CDE expertise, utilizing evidence-based practices to manage T2D. Incorrect approach is analysis, an approach that focuses solely on current lifestyle factors without considering genetic predisposition or the underlying pathophysiology of insulin resistance and beta cell dysfunction, is incomplete. This failure to consider the full spectrum of contributing factors can lead to an ineffective care plan, as it may not address the root causes of the patient's condition or anticipate future challenges. Ethically, this represents a lapse in providing comprehensive care, an approach that prioritizes immediate symptom management without assessing the progression of insulin resistance or beta cell dysfunction, overlooks the dynamic nature of T2D. This can result in a reactive rather than proactive management strategy, potentially leading to poorer long-term outcomes and failing to meet the regulatory standard of care for chronic disease management. An approach that solely relies on a diagnosis of metabolic syndrome without delving into the specific contributions of insulin resistance, beta cell dysfunction, and lifestyle factors limits the CDE's ability to personalize interventions. While metabolic syndrome is a critical indicator, understanding its components is essential for targeted education and management, and failing to do so can be considered a deviation from best practice. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough patient assessment, gathering information on all relevant contributing factors to T2D progression. This includes a detailed history, physical examination, and review of laboratory data. Next, the CDE should synthesize this information to identify the primary drivers of the patient's condition and potential areas for intervention. This synthesis should be guided by current evidence-based guidelines and regulatory requirements. Finally, the CDE should develop a collaborative, individualized care plan in conjunction with the patient and the healthcare team, ensuring that the plan addresses the multifaceted nature of T2D and promotes long-term health and well-being. Question 16. Risk assessment procedures indicate that a patient with type 2 diabetes, currently managed with oral agents, is experiencing persistent hyperglycemia despite lifestyle modifications. The patient expresses a strong desire to avoid multiple daily injections and prefers a regimen that offers flexibility in meal timing and composition. They are concerned about the potential for hypoglycemia and the impact on their social activities. Considering these factors and adhering to evidence-based practice guidelines for insulin initiation in type 2 diabetes, which of the following approaches would be most appropriate for the certified diabetes educator to recommend to the patient's physician? Option A. Suggests starting with a single daily injection of an intermediate-acting insulin e.g. NPH in the morning, with adjustments made based on fasting blood glucose readings. Option B. Initiate a basal bolus insulin regimen using a long-acting basal insulin and rapid-acting insulin before meals, coupled with comprehensive education on injection technique, site rotation, and hypoglycemia management. Option C. Recommend a premixed insulin e.g. 70/30 NPH/regular, administered twice daily before breakfast and dinner, emphasizing adherence to consistent meal times. Option D. Advise the patient to continue with oral agents and focus on further dietary restrictions, deferring insulin therapy until hyperglycemia becomes more severe. The correct answer is B. Initiate a basal bolus insulin regimen using a long-acting basal insulin and rapid-acting insulin before meals, coupled with comprehensive education on injection technique, site rotation, and hypoglycemia management. Explanation. Scenario analysis. This scenario presents a common challenge in diabetes management, where a patient's lifestyle and preferences must be carefully considered alongside clinical best practices for insulin therapy. The educator must balance the need for effective glycemic control with the patient's desire for flexibility and avoidance of frequent injections, while also ensuring the chosen regimen aligns with current evidence-based guidelines and regulatory expectations for patient safety and education. The risk of hypoglycemia or hyperglycemia due to suboptimal insulin selection or administration technique is a significant concern. Correct approach analysis. The correct approach prioritizes a comprehensive assessment of the patient's individual needs, including their daily schedule, meal patterns, physical activity levels, and personal preferences regarding injection frequency. This aligns with the ethical principle of patient-centered care and the regulatory requirement to provide education tailored to the individual's circumstances. Selecting an insulin regimen that offers a balance between efficacy and convenience, such as a basal bolus regimen with a long-acting basal insulin and rapid-acting insulin for meals, allows for greater flexibility in meal timing and quantity, thereby reducing the risk of hypoglycemia and improving adherence. The educator's role is to empower the patient with knowledge about different insulin types and administration techniques, enabling them to make informed decisions in collaboration with their healthcare provider. This approach adheres to professional standards of practice that emphasize individualized care and patient education for safe and effective self-management. Incorrect approaches analysis. One incorrect approach involves recommending a premixed insulin without a thorough assessment of the patient's meal patterns. Premixed insulins, while reducing injection frequency, offer less flexibility in adjusting doses based on individual meal intake and can increase the risk of hypoglycemia if meals are skipped or delayed, or hyperglycemia if meals are larger than anticipated. This fails to meet the standard of individualized care and potentially compromises patient safety by not adequately addressing the risks associated with fixed insulin ratios. Another incorrect approach is to insist on a complex basal bolus regimen with multiple daily injections without exploring the patient's willingness or ability to manage it. While clinically effective, forcing a regimen that the patient finds burdensome can lead to poor adherence, increased stress, and ultimately, suboptimal glycemic control. This disregards the patient's preferences and capacity for self-management, violating the principle of shared decision-making and potentially leading to adverse outcomes. A third incorrect approach is to focus solely on the type of insulin without discussing administration techniques. Improper injection technique can lead to variable insulin absorption, affecting glycemic control and increasing the risk of lipohypertrophy, which further impairs absorption. Failing to provide comprehensive education on administration techniques, including site rotation and needle disposal, is a regulatory and ethical oversight that directly impacts patient safety and treatment efficacy. Professional reasoning. Professionals should adopt a systematic approach that begins with a thorough patient assessment. This includes understanding their current diabetes management, lifestyle, preferences, and any barriers to adherence. Based on this assessment, the educator should then discuss various insulin therapy options, explaining the benefits and drawbacks of each in relation to the patient's specific situation. This discussion should cover different insulin types: rapid-acting, short-acting, intermediate-acting, long-acting, premixed, typical insulin regimens, basal bolus, fixed combinations, and essential administration techniques. The goal is to collaboratively develop a personalized insulin plan that is safe, effective, and aligns with the patient's ability and willingness to manage their diabetes. Ongoing monitoring and regular follow-up are crucial to assess the effectiveness of the chosen regimen and make necessary adjustments. Question 17. Analysis of a patient's continuous glucose monitoring, CGM. Data reveals a pattern of frequent glucose fluctuations, including both hyperglycemia and hypoglycemia, occurring primarily in the late afternoon and early evening. The patient reports no significant changes in their usual diet or medication regimen, and denies experiencing any specific symptoms during these periods. As a certified diabetes educator, CDE, what is the most appropriate next step in managing this patient's diabetes? Option A. Advise the patient to increase their basal insulin dose to proactively counteract the anticipated afternoon glucose rise. Option B. Recommend a blanket reduction in the patient's carbohydrate intake at all meals to minimize glucose variability. Option C. Instruct the patient to ignore the late afternoon and early evening glucose fluctuations, as they are likely transient and not clinically significant. Option D. Review the patient's detailed food logs and activity records for the past week, specifically looking for subtle variations in carbohydrate intake timing or type, and the intensity and duration of physical activity to correlate with the observed glucose patterns. Correct answer is D. Review the patient's detailed food logs and activity records for the past week, specifically looking for subtle variations in carbohydrate intake timing or type, and the intensity and duration of physical activity to correlate with the observed glucose patterns. Explanation. This scenario is professionally challenging because it requires the certified diabetes educator, CDE, to balance the technological capabilities of continuous glucose monitoring, CGM, with the individual's unique diabetes management needs and understanding. The CDE must interpret complex data patterns, not just individual readings, and translate them into actionable strategies that are safe, effective, and aligned with the patient's goals and lifestyle. This requires a deep understanding of CGM technology, its limitations, and the physiological responses to diabetes management interventions. The correct approach represents best professional practice because it prioritizes a collaborative and individualized strategy. By reviewing the CGM data in conjunction with the patient's self-reported behaviors and symptoms, the CDE can identify trends and correlations that might otherwise be missed. This holistic review allows for personalized adjustments to the diabetes management plan, such as medication timing, carbohydrate intake, or physical activity, which directly addresses the root causes of glucose excursions. This approach is ethically sound as it respects patient autonomy and promotes shared decision-making, ensuring the patient is an active participant in their care. It also aligns with professional guidelines that emphasize evidence-based practice and patient-centered care, ensuring that interventions are tailored to the individual's specific needs and circumstances, thereby maximizing therapeutic benefit and minimizing risk. An incorrect approach that focuses solely on the numerical data without considering the patient's context fails to acknowledge the complexity of diabetes management. This could lead to misinterpretations of glucose patterns, potentially resulting in inappropriate or even harmful recommendations. For example, recommending a significant medication change based on a few high readings without understanding the patient's recent dietary indiscretions or illness would be a regulatory and ethical failure. It violates the principle of providing safe and effective care and could lead to adverse events. Another incorrect approach that involves making broad, generalized recommendations based on common CGM patterns without individualizing them is also professionally unacceptable. This disregards the unique physiological responses and lifestyle factors of each patient. Such an approach could lead to ineffective management, patient frustration, and a breakdown in the therapeutic relationship. It fails to meet the standard of care expected of a CDE, which mandates personalized interventions. The professional decision-making process for similar situations should involve a systematic review of all available data, including CGM metrics, patient-reported information, food intake, activity, symptoms, medication adherence, and clinical history. The CDE should then engage in a dialogue with the patient to understand their perspective and identify potential contributing factors to glucose variability. Based on this comprehensive assessment, the CDE should collaboratively develop a revised, individualized diabetes management plan, clearly explaining the rationale behind any proposed changes and ensuring the patient understands how to implement them and monitor their effectiveness. This iterative process of assessment, intervention, and evaluation is crucial for optimizing diabetes management with CGM technology. Question 18. The control framework reveals that a certified diabetes educator, CDE, is working with a patient from a South Asian background who expresses a strong preference for traditional curries, rice, and flatbreads as staples in their diet. The patient is concerned that adhering to standard MNT recommendations will mean abandoning these culturally significant foods, which are central to family gatherings and identity. The CDE needs to develop an MNT plan that supports the patient's diabetes management while respecting their cultural food practices. Which of the following approaches best aligns with professional ethical guidelines and best practices for culturally sensitive diabetes education? Option A. Provide the patient with a generic meal plan that focuses on lean proteins and non-starchy vegetables, advising them to adapt it as best they can to their cultural foods, without specific guidance on how to do so. Option B. Focus solely on the patient's blood glucose readings and HbA1c, explaining that adherence to MNT is secondary to achieving target numbers, and that cultural food choices are a personal matter outside the scope of diabetes education. Option C. Educate the patient on the glycemic impact of rice and flatbreads, and strongly encourage them to replace these with lower carbohydrate alternatives like cauliflower rice and whole wheat bread, emphasizing that this is the only way to achieve good glycemic control. Option D. Acknowledge the patient's cultural food preferences and explore ways to incorporate them into the MNT plan by discussing portion control for rice and flatbreads, suggesting healthier cooking methods for curries, e.g., using less oil and more vegetables, and identifying culturally appropriate lower glycemic index carbohydrate options within their cuisine. Correct answer is C. Educate the patient on the glycemic impact of rice and flatbreads, and strongly encourage them to replace these with lower carbohydrate alternatives like cauliflower rice and whole wheat bread, emphasizing that this is the only way to achieve good glycemic control. Explanation: the control framework reveals that adapting medical nutrition therapy, MNT, to diverse cultural food preferences and practices is a cornerstone of effective diabetes education. This scenario is professionally challenging because it requires a certified diabetes educator, CDE, to balance evidence-based MNT principles with the deeply ingrained cultural beliefs and dietary habits of their patient. Failure to do so can lead to non-adherence, poor glycemic control, and a breakdown in the patient-educator relationship. The correct approach represents best professional practice because it prioritizes patient-centered care and cultural humility. By actively seeking to understand and incorporate the patient's cultural food practices into the MNT plan, the CDE demonstrates respect for the patient's identity and values. This collaborative approach fosters trust and empowers the patient to make sustainable lifestyle changes that align with their cultural background, thereby improving health outcomes. This aligns with ethical principles of beneficence and respect for autonomy, as well as professional guidelines that emphasize culturally sensitive care. An incorrect approach that dismisses or ignores the patient's cultural food preferences is ethically problematic. It fails to uphold the principle of beneficence by not providing MNT that is likely to be adopted and sustained by the patient. It also disrespects the patient's autonomy by imposing a plan that may be incompatible with their cultural identity. Such an approach can be seen as a failure to adhere to professional standards of care that mandate culturally competent practice. Another incorrect approach that attempts to force a westernized dietary model without acknowledging or adapting to the patient's cultural foods is also professionally unsound. This demonstrates a lack of cultural humility and can lead to feelings of alienation and resistance from the patient. It fails to recognize that effective MNT is not a one-size-fits-all solution, but requires individualization based on a multitude of factors, including cultural background. The professional decision-making process for similar situations should involve a systematic approach. 1. Cultural assessment. Begin by inquiring about the patient's cultural background, food traditions, and significant dietary practices. This should be done with genuine curiosity and without judgment. 2. Collaborative goal setting. Discuss the patient's personal health goals and how they can be integrated with their cultural food practices. 3. Knowledge integration. Identify culturally relevant foods that can be incorporated into a balanced diabetes meal plan. This may involve researching traditional dishes and their nutritional composition. 4. Adaptation and modification. Work with the patient to modify traditional recipes or suggest substitutions that align with MNT recommendations while respecting cultural preferences. 5. Ongoing support and evaluation. Regularly assess the patient's progress and provide ongoing support, making adjustments to the MNT plan as needed. This iterative process ensures that the plan remains relevant and effective. Question 19. Compliance review shows a certified diabetes educator, CDE, is managing a patient with type 2 diabetes who has recently started taking a thiazolidine, TZD. The patient reports experiencing new onset of ankle swelling and shortness of breath, particularly when lying down. The CDE knows that TZDs can cause fluid retention and are contraindicated in patients with symptomatic heart failure. Considering the patient's reported symptoms and the known pharmacology of TZDs, which of the following represents the most appropriate immediate action for the CDE? Option A. Advise the patient to discuss their symptoms with their prescribing physician and explore alternative medication options that do not carry a significant risk of fluid retention. Option B. Focus on intensifying the patient's diet and exercise plan to manage their diabetes and mitigate any potential side effects. Option C. Reassure the patient that ankle swelling and shortness of breath are common side effects of many diabetes medications and are unlikely to be related to the TZD. Option D. Instruct the patient to immediately stop taking the TZD and monitor their symptoms closely. The correct answer is A. Advise the patient to discuss their symptoms with their prescribing physician and explore alternative medication options that do not carry a significant risk of fluid retention. Explanation. Scenario analysis. This scenario presents a common challenge in diabetes management, where a patient's medication regimen needs adjustment due to emerging side effects. The Certified Diabetes Educator, CDE, must balance the therapeutic benefits of a TZD with its potential risks, particularly in a patient with pre-existing cardiovascular conditions. The challenge lies in accurately identifying the most likely cause of the patient's symptoms, understanding the specific contraindications and side effect profiles of TZDs, and making a recommendation that prioritizes patient safety while adhering to evidence-based practice and regulatory guidelines for medication management. Correct approach analysis. The correct approach involves a thorough assessment of the patient's symptoms in the context of their medical history and current medications. Recognizing that fluid retention and edema are known side effects of TZDs, especially in individuals with heart failure or at risk for it, is crucial. The CDE's role is to identify potential drug-related adverse events and communicate these findings to the prescribing physician, recommending a discussion with the physician about alternative medications that do not carry the same risk of fluid retention, such as GLP-1 receptor agonists or SGLT2 inhibitors, which have cardiovascular benefits, represents best professional practice. This aligns with the CDE's scope of practice, which includes patient education, monitoring for adverse effects, and collaborating with the healthcare team to optimize diabetes management. It adheres to ethical principles of beneficence and non-maleficence by prioritizing the patient's well-being and avoiding harm. Incorrect approaches analysis. One incorrect approach involves dismissing the patient's symptoms as unrelated to the TZD without a comprehensive assessment. This fails to acknowledge the known side effect profile of TZDs and could lead to delayed diagnosis and management of a serious adverse event, violating the principle of non-maleficence. It also represents a failure to adhere to professional standards of care in monitoring patients on this medication class. Another incorrect approach is to immediately discontinue the TZD without consulting the prescribing physician. While discontinuing a medication causing harm is appropriate, the CDE's role is typically to report and recommend, not to unilaterally alter the medication regimen. This oversteps the CDE's scope of practice and could disrupt the patient's overall treatment plan without physician oversight, potentially leading to glycemic instability and violating professional boundaries and regulatory guidelines for medication management. A third incorrect approach is to focus solely on improving glycemic control through diet and exercise without addressing the potential TZD side effect. While lifestyle modifications are fundamental to diabetes management, they do not mitigate the risk of fluid retention caused by TZDs. This approach neglects a critical aspect of patient safety and fails to address the likely cause of the patient's symptoms, demonstrating a lack of comprehensive understanding of the medication's impact. Professional reasoning. Professionals should approach such situations by first conducting a thorough patient assessment, including a detailed review of symptoms, medical history, and current medications. They should then consult reliable, evidence-based resources, e.g., drug information databases, clinical practice guidelines, to understand the potential side effects and contraindications of the prescribed medications, specifically TZDs in this case. The next step is to correlate the patient's reported symptoms with the known adverse effects of the medication. Finally, the professional should communicate their findings and recommendations clearly and promptly to the prescribing physician, advocating for the patient's best interest and collaborating on an updated treatment plan. This systematic process ensures patient safety, adherence to professional standards, and compliance with regulatory frameworks governing healthcare practice. Question 20. Research into the optimal macronutrient distribution for individuals with type 2 diabetes has highlighted the importance of a balanced approach. Considering a patient newly diagnosed with type 2 diabetes who is seeking guidance on their dietary intake, which of the following approaches best reflects current evidence-based recommendations for macronutrient management, focusing on carbohydrate quality, protein intake, and fat intake types and amounts? Option A. Focus exclusively on strict carbohydrate counting, aiming for very low daily carbohydrate intake regardless of the source, with minimal emphasis on protein or fat quality. Option B. Emphasize whole, unprocessed carbohydrate sources, moderate protein intake to support satiety and muscle maintenance, and prioritize unsaturated fats while limiting saturated and trans fats, all within a framework of individualized carbohydrate counting. Option C. Advise a very low-fat diet, with a focus on consuming refined carbohydrates and increasing protein intake to compensate for reduced fat. Option D. Recommend a high-protein, low-carbohydrate diet with a significant increase in saturated fat intake to promote satiety and improve glycemic control. The correct answer is B. Emphasize whole, unprocessed carbohydrate sources, moderate protein intake to support satiety and muscle maintenance, and prioritize unsaturated fats while limiting saturated and trans fats, all within a framework of individualized carbohydrate counting. Explanation: this scenario is professionally challenging because it requires balancing evidence-based guidelines with individual patient needs and preferences, all within the scope of practice for a certified diabetes educator, CDE. The CDE must navigate the complexities of macronutrient recommendations, ensuring they are aligned with current scientific understanding and regulatory expectations for diabetes management. The correct approach represents best professional practice because it prioritizes a personalized, evidence-based strategy that considers the individual's metabolic profile, lifestyle, and cultural background. This aligns with the ethical imperative to provide patient-centered care and adhere to professional standards of practice, which emphasize individualized nutrition therapy for diabetes management. Regulatory frameworks for CDEs typically mandate that recommendations be based on current scientific evidence and tailored to the individual. An incorrect approach that focuses solely on a rigid, one-size-fits-all carbohydrate counting method without considering carbohydrate quality fails to meet the comprehensive nature of diabetes nutrition recommendations. This could lead to suboptimal glycemic control and neglect the importance of nutrient-dense carbohydrate sources. Ethically, this approach is deficient as it does not fully address the patient's overall nutritional well-being. Another incorrect approach that overemphasizes protein intake at the expense of other macronutrients, without a clear clinical indication, could lead to potential kidney strain in individuals with pre-existing renal issues and may not be the most effective strategy for glycemic management. This deviates from balanced macronutrient recommendations and could be considered a failure to adhere to evidence-based guidelines. A third incorrect approach that promotes a very low-fat diet without considering the type of fats and the individual's caloric needs might lead to deficiencies in essential fatty acids or inadequate energy intake, impacting overall health and adherence. This demonstrates a lack of nuanced understanding of fat's role in diabetes management and could be a regulatory concern if it leads to adverse health outcomes. The professional decision-making process for similar situations involves a thorough assessment of the patient's current health status, including glycemic control, comorbidities, and laboratory values. This is followed by a review of current evidence-based guidelines for diabetes nutrition therapy. The CDE then collaborates with the patient to develop a personalized nutrition plan that incorporates their preferences, lifestyle, and cultural considerations, while ensuring adequate intake of all macronutrients in appropriate forms and quantities. Ongoing monitoring and adjustment of the plan based on the patient's response are crucial.